Nice to see you again, guys. So, talking about obesity, I think the first thing anybody would tell you is diet. I think we spoke about diet in our first blog. Then people, second thing would tell you, go for walking. Start walking. I think you lose your weight is the easiest, cheapest advice anybody can give. So what do? We start buying very good shoes. We start buying good fitness equipment. So after that, we start coming to walking. So what do? We either buy a treadmill, the first thing we do, or we buy something like a cross trainer. There are a lot of shows that happen on the TV. So one of it is already home, like the one which I have in my gym. But like in many of your houses, even in my house, people only dry clothes on this most often. Because this treadmill is the biggest failure anybody can have in the house. Okay, let's not try to discourage you. Considering you have one, or you plan to buy one, or probably you're going to the gym and you find a good treadmill there. So the first thing anybody starts doing is walking. So the title for this third video blog is going to be cheating the walking. I mean, let's cheat the walking. Let's see. So the first question anybody would ask us is, Doc, how much should I walk? How long should I walk? And they want us to tell 15 minutes, they want us to say 20 minutes, they want us to say something, people want us an answer. Is that the answer? 20 minutes, 30 minutes? No. That's not the answer. So we need to know why we are actually walking. Walking as a purpose. So when you go to any gym, like this multinational or the big gyms that you all know of, there is one thing that is common in these gyms, which is called a cardio floor or a cardio area or a cardio section, where they have something like a treadmill, where they have something like a cross trainer, or they have something like this cycling equipment or a rowing kind of an equipment, which all have something in common with these kind of patches where you can actually keep your hand. This basically is to measure your heart rate. So, what I'm trying to explain to you is the intent of all these equipments in the cardio floor. What does cardio mean? The heart is to increase the heart rate. So unless your heart rate increases beyond a certain point, there is no meaning to all of these equipments, or in simple terms, there is no meaning to your walking. So your walking has to have a purpose. The purpose is to increase your heart rate beyond a point. So how much? I'll come to you. So timing, more than how long you do is not important. So many patients come back and tell me, oh doctor, I walk for 1 hour, I walk for 1.5 hours. Jolly, enjoying the climate, speaking on the phone, listening to music is not walking. If your heart rate doesn't increase, it is not walking at all. So how to calculate what is a good amount of walking that you do? So all these treadmills will tell you how much of heartbeat your heart is beating. Like doctors like us can, of course, see your pulse and tell, but the machines will actually tell you. So the maximum heart rate is called 220 minus your age. For example, you're 30 years old. Your maximum heart rate is 190. So in this 190, you have to do a minimum of 70 to 80%. So in 90, 70 to 80% is somewhere around 160. Or let's say even 150. So if you are doing your walking or jogging or anything, you need to put an effort that increases your heart rate more than 160. Of course, with age increasing, you can lower this limit. So this is the purpose of cardio, not just walking, but cross trainer, but any kind of an exercise that you do in the cardio floor. If you're not reaching this point, you aren't doing it properly. You're only cheating your walking. So walking has a purpose. Time is not important, but how your heart rate increases is more important. So try to hit the target for a minimum of 20 to 30 minutes, and that is enough to increase your basal metabolic rate, or the burning problem that I spoke to you in the previous episode. I'll come back to you with more interesting myths and facts in obesity. Join you soon.